Good evening, I'm Adrienne Arsenault.
And I'm Andrew Chang. Tonight, top doctors in Ontario's hotspots take matters into their own hands.
The case counts are horrific. They're not what we want to see.
Our trends have really taken a turn for the worse.
Schools suddenly shuttered, a public war of words, and what could be next?
Plus,
we've been going for a year. We have less and less people to do the work.
the calls from the front lines across the country to change course as hospitalization numbers swell and variants take hold.
Also tonight, play ball.
And this ball is gone.
The Jays play in front of a packed crowd in a reopened Texas. Can the U.S. vaccinate its way out of the next wave?
And a trip to the surface of the world's deepest lake to take in a tourism boom.
And then all of a sudden, all this money are here. Like all your dreams could come true.
But all those people bring problems to an ecological wonder. This is The National.
Well, after another holiday under the cloud of COVID, there is hope on the horizon as more vaccines come into this country.
But Canadians also find themselves looking at a tough new reality, deep into a third wave driven by variants, filling up ICU beds, and tonight, in the biggest province, an open dispute between public health officials and the government about how to get it all under control.
Ontario is only days into new province-wide restrictions, so you can see the curve still on a steep climb, with the 7-day rolling average more than double what it was a month ago. And the number that causes the most concern, 494 patients now in intensive care. That's a new record.
And that is why tonight there are sudden go-it-alone measures from one medical health officer closing hundreds of schools. Katie Nicholson joins us from outside Ontario's legislature tonight. So, Katie, can you take us through what the medical health officer in Peel is doing?
Yeah, Adrienne, 250,000 kids in Ontario will not be going to school tomorrow for in-person learning. This comes as public health leaders are breaking publicly with the province and pushing for new restrictions.
This is not the shutdown many medical experts wanted. Under Ontario's new rules, scenes like this were allowed as COVID numbers soared over the weekend.
The case counts are, horrific. They're not what we want to see.
Toronto's Dr. Eileen Davila, one of 3 medical officers of health, who penned this letter to the province's chief doctor, pushing for much stricter measures. A province-wide stay-at-home order that they say is necessary to prevent and mitigate large-scale morbidity and mortality, an irreparable strain on the healthcare system. Peel's medical officer of health says conversations are ongoing, but he's not waiting, taking decisive action on another front today, stopping in-person learning in schools in Peel region for 2 weeks.
We said, why don't we try to make it a bit of a cooling off period for schools, hopefully get other measures in place that will bring community transmission down as well.
The education minister's not budging, releasing this statement. Schools remain safe with strong public health measures in place that have kept nearly 99% of schools in Ontario open. Some statisticians see the numbers a little differently.
We are seeing school counts at the highest amount that they have ever been at before.
His read, more schools should move online.
So Ottawa, York, and Lake Toronto all have numbers that support movement online as well. They all have a huge increase in the number of cases.
In York region, north of Toronto, support for that idea from this doctor.
I'm seeing droves of kids coming in because of exposures. I want schools open. I have 3 school-age children myself, and I want them to be in school. But I don't want the schools to become another source of the problem.
So this is so stressful for so many, and I guess hundreds of schools in an Ontario hotspot clearly now closing. What are you hearing, though, about word of more closures coming?
Yeah, the picture is changing, and it's changing throughout the province. Tonight, we learned that Guelph doing the same thing as Peel, so students there moving to online learning as of Wednesday. That'll be for another couple of weeks while they sort of watch the situation. And we know of about 20 schools here in Toronto doing the same thing because of ongoing COVID investigations.
So closing schools, I guess that's one thing the regional chief medical officer of health in Peel feels like he can do if he doesn't get entirely what he wants from the province. What else is there to do?
Well, you know, Dr. Lowe said he wanted to stress they were really trying to have this dialogue, work something out with the province. But, you know, if it doesn't happen, they're in dire straits. And he told me that lawyers there in the region are looking at and studying whether or not they can have their own stay-at-home order for the Peel region. So if, you know, they can't get any joy from the province, this may be an option. And you can be sure that the other medical officers of health throughout the province will be watching that very closely. Adrian?
All right, Katie, thank you. In Quebec, 5 more municipalities are headed into lockdown tonight as the province tries to deal with rising case numbers involving more contagious variants.
Unless we can contain this outbreak in some way, we are going to have more people in the ICU.
New restrictions include an earlier curfew, the closure of non-essential businesses, and a suspension to in-person learning in schools. The province reported more than 1,200 new cases today and announced that one outbreak at a Quebec City gym has now spread to 171 people and is linked to 20 other outbreaks.
Now, the key word tonight continues to be variant. Not every province screens every positive test for a variant of concern, but here's what we can say about the situation across the country tonight. Of Canada's roughly 14,000 known variant cases, most are clustered in Quebec, Ontario, Alberta, and British Columbia. The one first found in the UK, still the most common. The one first seen in South Africa, still relatively rare. But it's the P.1 variant health officials are particularly worried about now. First found in Brazil, it is now the dominant strain in that country. And in BC, it's taking off like wildfire. 737 cases, mostly in Greater Vancouver, doubling in just 4 days. Proof of how fast this one spreads. Here's Briar Stewart on the latest threat.
In Vancouver, some got outside early today to enjoy the sun, while others lined up for a COVID test. BC is having a surge in cases.
And so we need to know more.
This professor estimates that about half of the province's cases are variant strains and 20% of those are P1. She believes people should be told more about how it's spreading.
We don't really have enough data yet to understand if it's a large group settings, indoors, lots of close contact that is the real risk, or if it's really rapidly transmitting.
P1, which has ravaged Brazil, has taken hold in BC. Whistler was shut down after a few hundred cases were detected there. Today, Alberta also reported 2 P1 outbreaks, including one linked to a large employer with multiple sites across Western Canada.
A lot is still unknown about the P1 variant, but research suggests it can be up to 2 times more transmissible. According to the BC Centre for Disease Control, the strain could reinfect somebody who's already had COVID, and vaccines might not work as well against the variant.
Doctors say all the variants are leading to more patients ending up in the ICU.
We are seeing less elderly people getting that sick, but that's now been replaced by seeing people between the ages of 20 to 50 now that are getting COVID and getting quite ill.
BC has rolled out more restrictions, including closing indoor dining, but not everyone is following the rules.
Get out! Get out!
This video shows one of the 2 restaurants that's had their licenses suspended.
But that's how they want to unfold the agenda.
Today, a small crowd protested the restrictions, but they didn't receive much support from the sidelines.
Yeah, I think it's pretty silly. We're all getting the vaccine, so we should, finish the stretch.
But with cases climbing, it could still be a few difficult months ahead. Briar Stewart, CBC News, Vancouver.
So Canada's 3rd wave is hitting a younger population and filling up beds in intensive care, prompting one doctor to share another emotional video about a patient in his hospital's COVID ward.
I have a patient in his early 30s in my ICU right now with COVID-19. He was completely healthy prior to acquiring his infection at work. He's not an essential worker. His coworker did not adhere to public health restrictions, did not wear his mask consistently, and gave him variant COVID-19. My patient required intubation. My patient got a blood clot. My patient was eventually extubated, but then had COVID encephalopathy, which is brain dysfunction from COVID-19.
All last week in Canada, there was a steady rise in the 7-day average of ICU occupancy. Most indicators say the trend is going to build. Carolyn Dunn shows us the growing apprehension over dwindling resources.
A quick photo to mark the moment. Benita and Nazaman Khan are about to get their first vaccine.
It's best to take the shot than getting taken out by the COVID-19, right?
But in today's race between vaccines and the variants, there are many places in Canada where the virus is winning. For the third straight day, Saskatchewan has a record number of ICU admissions. Even in New Brunswick, where case numbers are low, this hospital is nearing capacity.
We would not really want to have to see this situation arise where COVID positive patients would be transferred outside the zone, especially when we're seeing this as being most of the cases are the UK variant.
In southern Ontario, hundreds of patients have already been shuttled from one hospital to the next, as some operate above capacity. This Toronto area critical care doctor says the third wave is different.
We're seeing people in their 30s and 40s and 50s, and these are people that don't get sick from the flu or from pneumonia to the point of needing the ventilator.
Younger people who aren't yet vaccinated and those who must work outside the home are particularly vulnerable to catching and rapidly spreading COVID variants. Those variants tend to make people sicker, putting a strain on hospitals and healthcare workers.
I mean, we've been going for a year, and we have less and less people to do the work currently.
The concern is that some Canadians who will need intensive care might not be able to get it.
I think we're still trying to bargain with the virus and still trying to, do these half measures with the hope that things will be different this time.
Carolyn Dunn, CBC News, Calgary.
Well, Canada's vaccination ramp-up continues with nearly 2.2 million doses expected to be delivered this week. The majority will come from Pfizer-BioNTech and Moderna over the next 7 days, and then another 300,000 doses are Oxford-AstraZeneca shots, which Canada purchased through the global vaccine sharing initiative known as COVAX. And speaking of vaccines, the United States continues to immunize its citizens at a pretty rapid clip. But as Ellen Morrow shows us, loosening restrictions and another holiday travel record mean the vaccines are in a real race with the variants.
Another COVID Easter, even bunnies wearing masks, and that famous White House egg roll canceled again. Still, President Biden offered a message of hope.
We know that long-for dawn is almost here.
That optimism fueled by a rapid vaccine rollout. Over 40% of American adults have had at least one shot.
There you go.
More than 20% fully vaccinated, 10 times the amount in Canada.
We are vaccinating at a rate of 3 million people on average every day.
Some of those crowd shots.
But that's not stopping fears of a fourth wave.
This is the first big crowd at a baseball game.
Look at this crowd. The Blue Jays playing the Texas Rangers, full capacity, few masks. Texas fully open is just one of several states easing restrictions.
The rollout of vaccines is not keeping pace with the new variants, and it's not keeping pace with the lifting of restrictions across the United States.
Cases are rising again, up 7% over the past week. More than 64,000 Americans still testing positive every day. Hospitalizations creeping up too.
We're just at the beginning of this surge. We haven't even really begun to see it yet.
Also surging, travel. Some 6 million people flying over the holiday weekend, the busiest days since COVID struck.
I think it was a little too crowded on the airplane.
I felt kind of weird, like being really close to people.
The Biden administration is urging Americans to stay cautious, promising normal isn't far away.
I understand that people are tired and that they are ready for this pandemic to be over, as am I. Please continue to hang in there and to continue to do the things that we know prevent the spread.
The administration says the next few weeks will be crucial. The hope is that by May 1st, every American adult will be eligible to receive a vaccine. Ellen Morrow, CBC News, Washington.
The chief of the Minneapolis police testified today that Derek Chauvin violated police policy when he pressed his knee into George Floyd's neck, as seen in that bystander video that sparked global protests. We've chosen not to air the most disturbing moments of that video, but to illustrate a key moment in the defense strategy, tonight you'll see a still image from it. Here's Susan Ormiston.
Thank you, sir.
Chief Arredondo said at midnight last May 25th, someone left him a message.
Chief, have you seen the video of your officer choking and killing that man?
He fired Chauvin the next day and testified today the officer absolutely violated policy.
Clearly, when Mr. Floyd was no longer responsive and even motionless, to continue to apply that level of force in no way, shape, or form is anything that is by policy, it is not part of our training, and it is certainly not part of our ethics or our values.
A clear directive, he said, always is to de-escalate.
Do you believe that the defendant followed departmental policy 5-304 regarding de-escalation?
I absolutely do not agree with that.
Use of force at the time did allow for neck restraints, but with moderate pressure.
The facial expression of Mr. Floyd, that does not appear in any way, shape, or form that is light to moderate pressure.
But the defense tried to raise doubts about the placement of Chauvin's knee, pulling up a comparison between bystander video on the left and police body cam on the right, just before paramedics took Floyd away.
It appeared at that moment in time that the knee of the defendant was more towards the shoulder blade. Is that right?
That is correct.
But the chief reasserted the knee was earlier on Floyd's neck. Outside the court, the Floyd family is optimistic.
You know, I'm just building my trust and knowing that I'm really confident that it's going to go have a good outcome.
Susan Ormiston, CBC News, Washington.
In New Brunswick, a First Nation community is questioning if an early crab fishing season is to blame after a boating tragedy off the coast of Cape Breton this weekend. Some say conditions are too treacherous and the added pressure to compete with bigger boats has put their fishermen at risk.
As fishermen, you know, when the season opens, you want to be the first ones there, and they went up and then we lost 2 men.
One crew member died and the ship's captain is presumed dead. Their boat capsized on the first day of the season, which started earlier than usual to protect endangered whales.
Also in New Brunswick, there is concern about a new and mysterious illness. Experts are studying dozens of cases of an unknown neurological disease. Not only do they want to understand it, they need to figure out where it comes from. Kayla Hounsell shows us a family searching for answers.
This is Roger Ellis, and this is how he's been since he collapsed at home nearly 2 years ago. Just weeks before, he had been dancing with his wife.
Within the first few weeks of being in the hospital, he was having hallucinations, delusions, memory loss.
He went through a battery of tests.
It's not cancer, it's not a brain tumor, it's not a stroke, it's not epilepsy. We just want to know what it is.
Now, another possibility, an unknown neurological disease first detected in New Brunswick in 2015. But the public was only told about it 2 weeks ago, after Radio-Canada obtained an internal memo. That's when the chief medical officer of health confirmed something unusual is happening.
So it most likely is a new disease. We haven't seen this anywhere else.
The cases are concentrated in the Moncton region and the Acadian Peninsula, 44 in total. 6 people have died. Ellis is not among the confirmed, but the doctor at the helm of the research has agreed to take on his case.
The initial symptom is unusual behavioral changes that include most of the time anxiety, sometimes aggressivity.
Dr. Marrero initially believed his patients had Creutzfeldt-Jakob disease, but the tests came back negative. Still, Marrero says there's no need to panic.
This team effort is an effort of hope, not of despair. We actually believe we will find it.
Steve Ellis, who now lives in Nova Scotia, is hopeful, but says the lack of information is causing speculation.
People are very nervous about what it could be. Is it the fish that I ate? Is it the air that I breathe? Is it the soil that I touched?
He's worried it may be too late for his father.
Ready to go for a walk? We went.
Ellis has created an online support group to connect with others who are undiagnosed, hoping together they can help identify the cause of the still mysterious disease. Kayla Hounsell, CBC News, Bridgewater, Nova Scotia.
Well, the town of Humboldt, Saskatchewan is marking a somber anniversary with a powerful act of remembrance. Tomorrow marks 3 years since that devastating bus crash killed so many and changed the lives of many more. Here's Karen Pauls with the plans for a permanent tribute.
3 years on, this intersection remains a haunting reminder of how fast tragedy struck. It's where the Humboldt Broncos team bus hit a semi-truck that blew through a stop sign, killing 16 and injuring 13. Today, the Broncos Tribute Committee announced plans for a permanent memorial, something player Logan Boulet's parents say is important for keeping the memories alive.
Because as time goes along, they'll know about the Humboldt crash, but they won't know so much about the people or who they are.
Evan Thomas's family will be at the site at 4:50 tomorrow, the approximate time of the crash. His dad not sure what kind of permanent memorial he'd like to see.
What's there right now is so powerful. You know, everything that's there, people took time out of their lives to leave there. And every time we go there, the silence is so powerful.
Also announced today, a $25 million tribute center in Humboldt, including a gallery dedicated to telling the stories of lives lost and former coach Darcy Hogan's core covenant.
Darcy got it. It's everything his core covenant stands for. That is what we need to embrace and grow.
Attached to the existing arena, it will include another ice rink, a fitness facility, and physical therapy center. That's especially meaningful to Carol Bronze, whose daughter Dana was the team's athletic therapist.
And there has to be something positive come out of this, because if nothing comes out of it positive, then the tragedy is even that much bigger. Right?
The fundraising campaign has some powerful support.
On behalf of myself and my teammates, just want to say congratulations on the new facility.
You're an inspiration to all of us.
All of this is still a few years into the future, but the families and the community hope this will keep them looking forward and not just back. Karen Pauls, CBC News, Winnipeg.
There are concerns tonight that hundreds of thousands of Canadian students may never return to school.
They're out of school with no prospect of return.
Next on The National, why the pandemic may be driving up dropouts.
Canadian scientists unveil their insect-inspired test for COVID immunity.
The more antibodies in a blood, the more light-emitting power.
And Siberia's frozen sacred lake turned tourist hotspot.
And then all of a sudden, all this money are here. Like all your dreams could come true.
But what's happening below the surface? We're back in 2. You are looking at flames engulfing this Environment Canada weather station in Iqaluit near the airport. Fire crews have been on the scene since this afternoon. There's no word yet on the damages, but it is worth noting that station is filled with sensitive equipment that provides some pretty critical data about weather and climate across the entire Arctic.
Well, as we mentioned, another 250,000 kids in Ontario are out of class again tomorrow. The latest interruption to learning in a year full of them. But tonight, new research shows that thousands of kids over the past year never made the move to online learning. In effect, they dropped out. Here's Deanna Sumanek-Johnson on the fear they may never come back.
When we talk about learning during the pandemic, Irvin Student says there's one group of kids no one is considering.
They're out of school with no prospect of return.
Student and his think tank started an international commission to help locate and reintegrate the students who stopped attending school of any kind during the pandemic.
When we closed the schools here, we presumed that everyone elegantly went online. And we forgot that at least 6% of the population in Canada has no access to online.
6% of school kids in the provinces that had substantial school closures is 200,000 kids.
On top of that, abusive homes, very poor homes, children with problems in English or parents with problems in English.
200,000 kids. That's
Teacher and behavioral expert Kirby Mitchell says there's another type of student who has disappeared from the system.
Students that I'm used to seeing wandering the halls, they're no longer there. Students I'm used to seeing acting out in class, they're no longer there. And so those numbers I see as students that don't fit the online space, as well as the current classroom where you have to follow certain restrictions.
My biggest worry is that it's going to get so bad that we will never be able to get these kids back in. We'll never be able to reach them again.
This problem is attracting global attention. The United Nations recently estimated 12 million kids globally have dropped out of school during the pandemic.
This is a serious problem, and I do think that the UN Secretary General has a complete point about that it could be a generational catastrophe.
Preventing that catastrophe starts with finding out exactly how many kids are missing, who they are, and where they've gone. There are efforts by individual teachers and schools to find the missing kids, but few school boards have a specific post-pandemic plan in place to track them down and get them back in the system. Deanna Sumanak-Johnson, CBC News, Toronto.
Next, we will visit a tourist hotspot in frigid Siberia. The world's deepest lake attracts millions of tourists, but at what cost? Plus,
Our test is performed in one single step in 1 hour.
A simple test for COVID immunity, made in Canada, inspired by insects.
deep in the heart of southern Siberia lies Lake Baikal, one of Russia's greatest ecological treasures. It is the world's deepest lake. It holds the largest amount of fresh water of any lake in the world, and it's home to thousands of species of plants and animals, many of them unique to the region. So all of that natural beauty naturally attracts millions of tourists every year, but that means growing environmental pressure. Chris Brown and his team traveled more than 5,000 kilometers to bring us the story of a bitter fight over one of the world's most curious natural wonders.
Who would have thought that a holiday in frozen Siberia would become the hot thing to do? But that's the case on Russia's Lake Baikal. Tourists zoom in on hovercrafts to marvel at ice so clear that you feel compelled to skate on it, or pose for Instagram with it, and for some, drink a shot straight off of it. Igor Pobotkin brings people here for a living.
Много отдыхающих приезжает, сейчас прям такой бум. Второй сезон появился. Если раньше был сезон только летом, то сейчас, благодаря в том числе вот и журналистам, и журналам, которые разные вот эти там публикуют фотографии, самый большой каток в мире, самый чистейший лед, самый, кстати, большой запас пресной воды такой стратегический у нас. Вот, и это привлекает.
Everyone here, including us, is traveling up the western shore of Baikal to Olkhon Island, a unique ecosystem within the lake. Beneath us, the bottom plunges to over 1,600 meters in places, making Baikal the deepest lake in the world, adding to its impressiveness. We arrive at Shaman Rock, a place so sacred some people worship it. 13 prayer poles wrapped in colorful ribbons represent the deities of nature. Ludmila Komponets comes here to share her spirituality with the tourists.
И крепко держите. Мы получаем силу огромную от этой синхронности. От матушки Земли, от батюшки Байкала, огромная толща воды.
A decade ago, international visitors here were just a trickle. Now, before the pandemic, almost 500,000 came, many from China and Europe. With the borders now closed, Russians such as Elena Ivanova are making up for them.
I'm very grateful for this part to COVID because we have a chance to travel to see our own country, which we don't know because, again, the priority always been to travel abroad.
With the tourists, though, have come immense growing pains for Baikal and its people. This remains one of the poorest regions in Russia. Many homes and towns along the lake don't even have flushing toilets. For decades, the main village on Olkhon was an impoverished fishing community.
When we started, they used to be people who didn't have money.
Natalia Bencharova and her husband Nikita moved here from Moscow 20 years ago and opened Olkhon's first guest house.
For so many years, it was really poor to the point that you ask your neighbor for food. And then all of a sudden, all this money are here. And you have, like, all your dreams could come true. You can have a car.
Hotels popped up everywhere, but the infrastructure to deal with sewage did not. Everything has to be trucked off the island. In winter, it's via an ice highway, only it's an open secret a lot of the waste gets dumped into the lake instead. Vitaly Ryabtsev is a local environmentalist who accompanied us for part of our trip.
Сейчас именно туризм является основным источником загрязнения Байкала.
We met him in the tourist town of Lisvyanka. Its waterfront is often packed with people spilling out onto the ice. If it's too cold outside, there are other attractions too. This is a show by Baikal's unique freshwater seals. Here, they're dressed up for a military holiday. All of this commercialization threatens Baikal's water purity, says Ryabtsev.
Я считаю, что главная ценность Байкала – это мировой колодец. Здесь 20% всех запасов питьевой воды. Второго такого объекта в мире нет. И к нему надо относиться именно как к колодцу. А колодец планеты и массовый туризм, я считаю, это две вещи несовместные.
The damage is already stark in places. This is a clean lake bottom versus one choked with algae. This past fall, biologists tested water samples and found most places with human settlements on the lake had some contamination. Sheets of stinking, rotten algae are becoming more common. The olmol, a tasty whitefish unique to Baikal, is now endangered, although we had no trouble finding people willing to sell us some illegally. The central government in Moscow says it's very concerned about the pressure on the lake, but its response has enraged many here even more.
The law is not clear. The law is not right, and we do not have clear rules.
Galina Sibir-Yankova is a member of the Buryat Nation, the local indigenous people, and she wants to ensure she leaves a clean lake for her daughter. She says once politicians started making new rules, they picked their own favorites, and local people were the losers.
And now they ask people, they say to people that their homes are not legal.
The issue is that in Soviet times, much of this place was a national park, but its boundaries were poorly defined. Over time, authorities sold off Olkhon's land, but many of those transactions have now been declared illegal. Now, new buildings are empty, ordered torn down, and everyone in town knows about the Pink House. Elena Plokhova has arguably lost more than anyone. She and her husband Andrei moved to Olkhon 4 years ago and bought some land, intending to run a bed and breakfast. Then they were told the deal was illegal.
Нас очень сильно давили, что мы должны отсюда уехать, что должны снести свой дом. Суды начались, конечно. Он любил природу.
Andrei, who was 46, couldn't handle the stress, she said. He had a heart attack.
Вся ситуация была такая сложная, что муж мой не выдержал. И у него не выдержало сердце, и он умер. Ну, то есть было настолько сильное давление, что мы уже думали, ну что может быть еще хуже.
Elena is still in the Pink House as the court case drags on.
Ну как же, землю же выдало государство. И государство же пытается забрать ее.
Plokhova's case may be the most tragic, but it's not unique. Before the pandemic hit, Olkhon residents staged a protest arguing the land expropriation is about officials in Moscow trying to give it to their cronies instead. Vitaly Ryabtsev, the environmentalist, is hardly a friend of the Putin government, but he believes returning land, including that pink house to the park, is the right thing to do.
Я думаю, что было бы прекрасно, если бы хотя бы самых оголтелых, вот типа вот этого розового дома, действительно снести.
So this is our second part of the property.
Visitors, though, will keep coming to Baikal, and it's a good thing, too, says Natalia Bencharova. She's clashed with Vitaly Ryabtsev many times.
You know, I suffered a lot because actually I felt kind of guilty for developing tourism here. And that's what I heard from Vitaly and others, that it's me who is personally responsible for developing tourism here. And then I thought that probably if we didn't develop tourism the way it is now, this was the fear that big businesses could come.
Baikal inspires a deep connection with many who visit. Saying goodbye is hard, but increasingly people are asking whether welcoming the world is coming at too high a price. Chris Brown, CBC News on Lake Baikal.
Wow, that is a stunning part of the world. Okay, next, a simple made-in-Canada test for COVID immunity.
Our test is performed in one single step in 1 hour.
The science inspired by insects, why it could be a game changer, and later.
Really, it fills my heart to no end. I mean, I can't even describe how I'm feeling today.
A moment of joy after a community finds a new friend for a teenager in need. England is ramping up its COVID testing efforts by giving everyone in the country access to 2 rapid tests a week.
People self-isolate when they have a positive test, so we keep that disease under control, and it allows us to get on with opening up in a safe way.
Starting Friday, the free at-home test will be made available at testing sites, workplaces, pharmacies, and even through the mail. They can provide results in about 30 minutes. This plan comes as the country announced an easing of pandemic restrictions starting next week, with the opening of all shops, gyms, hair salons, and outdoor pubs and restaurants.
Canadian scientists, meanwhile, have found a new way to detect COVID-19 antibodies with a little inspiration from fireflies. The key is using what gives them their glow. And as Iqaluit shows us, the test's inventors say their solution is both faster and cheaper than what's currently available.
Fireflies have a unique enzyme called luciferase, which gives them their glow. It's used in biotechnology, but now researchers are harnessing luciferase for a rapid coronavirus antibody test that doesn't need a lab and has proven highly accurate on human blood samples.
The amount of antibodies will depict how much of a light emission power luciferase will give you. The more antibodies in the blood of a person, the more light emitting power of luciferase, which can then easily be detected.
Our immune system creates antibodies after we're infected by the coronavirus or if we're vaccinated against it. Antibody tests tell us something important most other rapid tests can't: our level of immunity. But conventional antibody tests consist of 3 steps and take hours in a lab.
Our test is performed in one single step in 1 hour. And we can accurately, with high precision, say what's the concentration of the antibodies a certain person has in blood against this SARS-CoV-2 coronavirus.
Disease experts say even after mass vaccinations, we may need to periodically check our level of antibodies. A portable test that requires just a pinprick of blood could help.
Especially for dealing with new variants. And so a lot of these antibody-based tests are going to be adapted so that we can understand how well our current immunity works against new and emerging variants against disease.
Canadians may need a booster, a bit like your booster shots that you get for other things, or you need to do it annually because the virus changes annually. We don't know that yet. We'll have to learn that.
Answers about what could come next in this pandemic, thanks in part to the glow of the firefly. Iqaluit, CBC News, Toronto.
Next, serving up a bowl of gourmet gratitude.
So if that's the chicken noodle,
right? And here's some sticky toffee, and then here is our vegetarian one.
Delicious. Why this chef is feeding frontline workers from his garage. Welcome back. Daryl Neem2 has a message for frontline workers. Soup's on. The Red Seal chef, which means he is nationally certified, has been serving up tasty bowls of gratitude. He has handed out a lot of meals from the end of his driveway and collected a few stories along the way. David Common paid him a visit.
Meals prepared in a garage might not be your idea of fine dining, but Daryl Neem2 is a Red Seal chef with bundles of international experience.
So we're gonna do the chicken noodle first. Chicken, carrots, our onion.
Over the past few years, Daryl has helped retirement and nursing homes spice up their cuisine. The pandemic shut that down, but ramped up a special project on the most comforting of food.
So if that's the chicken noodle, right? And here's some sticky toffee, and then here is our vegetarian one.
Thinking of the many frontline workers here in Ontario's Niagara region, Daryl packages up 3 tasty thank yous.
Sun's coming up for you, Daryl. Yeah.
Where are these heading?
These are going to Niagara on the Lake to migrant farm workers that are here.
Healthcare workers, they're still working double shifts and 6 and 7 days a week, so this is really thoughtful for them.
Well, we appreciate all that they do. Pleasure meeting you.
They pull up.
Could you take some back to the guys at the shop?
Walk by.
Okay, I'm gonna grab a box then, is that okay?
Bring kids. Talk through the year that's been.
I'm on the pandemic response team focusing on COVID outbreaks.
Wow. Can we give you a bunch to take back to the office?
Stephanie Hawksby is a public health nurse in the region.
So the rest of us are tired. You must be exhausted.
I am exhausted, but it's still the fight, and I just think that I'm part of something that I could look back and said I was part of this pandemic, I was part of this fight against COVID, and I made it through and helped our community out.
You get the sense it's about more than just a meal. An opportunity, however brief, to be with others, to be appreciated.
You must be collecting some stories along the way. A fair amount. Thank you. A fair amount of folks of what they do, right? It's a wide breadth of frontline heroes. What are they telling you about what the last year's been like for them? Stressful. It's tough. They're underwater, right? They're overworked and they're scared. A lot of folks, right? Yeah. Be well, be safe. Thank you so much.
Personal support worker Michelle Raffanan has lived through an outbreak at work, tried to keep her resident spirits up, sapping her own along the way.
That is tough work.
It is.
But it's rewarding.
But it's very rewarding, yeah. Our residents have been grateful and they've been so thankful.
So all this is just that, a simple yet deeply meaningful thanks.
What we're trying to do here is say truly thank you to the people that are out there risking their lives every day, and we want to give back, and soup's comforting.
Thank you.
Sure is, and quickly snapped up a driveway delivered dose of warmth. David Common, CBC News, St. Catharines, Ontario.
A good deed never looked so delicious. And more giving next on The National. The story behind this new furry friend and why it means so much. Our moment is next. Well, Austin Lapointe and his mom had a new member join their family this weekend. This little puppy named Goofy. But the story gets even sweeter. It was a gift from some community members hoping to help Austin fill the space his previous support dog left behind. Tonight, their gift is our moment.
I received a little baby rough collie at 8 weeks old. His name is Goofy.
He went down to take a puppy to a 17-year-old boy named Austin.
And we seen him smile. It was worth everything. Unbelievable.
Austin's got Asperger's and type 1 diabetes.
I was quite surprised. I wasn't expecting any of this at all. It feels very great considering We had lost my previous dog. I've missed having a little furry friend around the house.
This dog's going to be not just a family member, but he's also going to be Austin's therapy, emotional support dog.
It's always been the island way. I mean, we never let anybody fall, and when we do, we make sure we pick them up and dust them off and get them in the right direction again.
It fills my heart to no end. I mean, I can't even describe how I'm feeling today.
So, fun fact, as you may have noticed, Goofy is the same kind of collie as Austin's former dog, which was really important to Austin. But we were also just talking a moment ago about how they have high hopes to have Goofy become their new service dog.
Absolutely. Well, the old dog used to be able to detect when Austin's blood sugar was really low. So the plan is to get Goofy trained up to do that too, to help Austin live independently. Clearly, Austin, the bond is already there with the dog. You're well on your way.
Yeah.
That is national for April the 5th. Good night.
Good night.